Hello, welcome. I'm Dr. Anthonio, and I will introduce you to my team. Today we will do unprotected left main procedure with the stentous Xposition S. Okay, come with me, please. So here's my team. My outer left is Yvonne, then we have Annemarie and George, and together we will perform the procedure. Okay.
The Stentus platform is a self-expanding stent platform that builds on the superelastic properties of titanium alloy. And because of its inherent design and properties, it exhibits no recoil. As spasm is relieved, the vessel diameter increases, and the stent follows in expansion and continues its scaffolding of the artery. Finally, as the thrombus dissolves, the stent expands further to absorb the gap left by the dissolving thrombus, thus maintaining a perfect apposition throughout the remodeling process of the vessel.
So, welcome. Today we will do a special case with ostial circumflex patient with a lesion in the ostial circumflex. The patient is a man of 82 years with atrial fibrillation in his history and bad left ventricle, for which he got biventricular pacemaker system, and at that moment the left ventricle became normal, and now he has a problem with angina, and he had the PCI of the circumflex, but now the problem is in the ostial circumflex, and when you want to solve this problem, we think you have also to perform a left main stenting, and because of the mismatch of the left main to the circumflex, we use for that a special technique and stent system, the Stentus Xposition S stent system. Okay, now we will start. As you can see, the left main is quite big, and there is significant stenosis in the proximal circ and also in the LPL, posterior branch. There is a significant stenosis, but that's a very small vessel. First, I suggest to just only treat this at this moment the ostium of the circ, and we have, I think, also to stent a part of the left main because it's an ostial lesion. And since the mismatch of the circ with the left main, we will use stentus, self-expandable stent. Puff. Cyan blue is positioned in the circumflex, and then we will go with the BMW towards the LED. Let's start with 2015 balloon. We do a balloon inflation. 14 atmosphere. Okay, leeg. And as you can see, with the 2.0 balloon, the circ is totally occluded. Now I will use a bigger balloon, an angiosculpt balloon, to make a controlled dilatation of the circ. Okay, doe maar 310. I use a 3010 for that, not too long, because I don't want to inflate it in the left main, only in the circ. But of course I have to inflate it in the ostium of the circ also. Scoring balloon is a variant of a cutting balloon. And as you can appreciate, there are some wires on the balloon which make a small cut in the plaque. Gaan we naar 14.
14.
En leg.
Leg.
So we did an inflation to 14 atmosphere, and I think we can now put a stent. Okay. Before we make a test, we give a little bit nitroglycerin, 0.6 milligrams intracoronary. Now you can see the lesion is a little bit wider, but not that much. I think we have to work some more on that. As you can appreciate, the blood pressure is low. It's because of the nitroglycerin. And what we will do, we will give a little bit more saline infusion. Okay. Komen we met een stentus Xposition. Now we will put the stentus Xposition S. It's a drug-eluting self-expandable stent, 3.5, 4.5, 26, something like that, 22. This self-expandable stent is balloon mounted and is covered with a small sleeve which will be cut open by balloon inflation. And since we have this system, it is possible to very good position the system in, for instance, ostial lesions or left main lesions. The guiding catheter was a little bit sucked into the left main, but with a little bit traction on the catheter, it was not very hard to retrieve the balloon. Oké, die kan weg. Ga je opruimen. Misschien even laten zien, het sleeveje. As you can see, this is the balloon which has been inflated, and this is the sleeve which was covering the stent, and is totally retrieved. Okay. So now we will do a post dilatation. Komen we met een 3,5, 20 non-compliant. 3.5, 20 non-compliant balloon will be used to perform a post dilatation in the stent. Of course the left main is bigger than 3.5, but first I want to size the stent part in the circ. Goes very easy in, as you can see, hopefully. Okay. This was the position where the stent was put. Now I have the roadmap to see where I can put my balloon. Okay, blaas hem maar op. 14,
14,
18,
18,
20,
20,
24.
24.
Okay, en leeg.
Leg.
So at this time when I do a very high inflation, the patient can have some chest pain. So So now we will do a proximal optimization of the left main part of the stent. Komen met een 4,5 10 non-compliant. 4,5 10 of 8. 4,5 8 or 10 non-compliant balloon. 8, yeah. Very good. 20.
20.
Leeg. And as you can see, still there is some contrast floating beside the balloon, so the balloon is a little bit undersized. Hebben we nog grotere? 5-0? Ja, doe maar 8. So we go a step higher, 5-0 balloon. It's a very simple trick to give some contrast when you do a balloon inflation in the left main. You could appreciate there was some contrast floating along. Here you can see towards the circ, but also to the LED. Of course, in the end of the procedure, we will perform a IVUS to look at the stent apposition and residual stenosis. But this contrast injection gives you a very good idea of what's going on, and it's a good way to size the stent. Now, as you could see, the left main was totally occluded by the balloon. So my BMW wire, which is still in the LED, is jailed behind the stent, and I will use a new BMW to recross and open the struts towards the LED. And for that I want to use a undersized balloon, just a 3015 compliant. Because of the stent design, it is not necessary to do a kissing procedure. Just open the struts and you have a good access to the side branch. But in the end we will finish with an ostial inflation of the circ. There's a little bit recoil of the stent on the ostium of the circ, so we will have to work on that. Okay. I choose for a compliant balloon, 4020. When you look at the sheet and the guiding, I have nearly no length left. Now we will position the balloon, 4020, compliant, okay. Blaas hem maar op.
Inflatie.
14. 18.
18.
20.
20.
24.
24.
En leeg. Kapot. So the balloon is finished. Unfortunately. On the other hand, I hope I have now good dilatation of the ostium of the circ. I will use a 408 non-compliant balloon for the proximal circ, so the recoil will be a little bit less. So you can see, even when there is optimal preparation with a 3.5 scoring balloon, there can be, but also because of the anatomy and the sharp hook of the circ with the LED, probably a little bit recoil. Anyway, the circ looks much better than it was before. And in the end we will perform a IVUS check to see how the sizes are. Oké, nou gaan we weer. Huffie? Ietsje verder. Ja, blaas hem maar op.
Inflatie.
10,
10,
14,
14,
leeg.
leeg.
Een beetje terug. Puff. Ja. 10,
Inflatie naar 10,
14,
14,
18,
18,
20
20,
en leeg.
leeg.
Oké. Hoeveel contrast hebben we gebruikt?
Ik denk dat we tegen de 100 zitten.
Oké.
Dat het niet goed is leeg.
Now we will perform a IVUS. At this moment we are working about 45 minutes. In the end we will do an ACT to see how much heparin additionally is needed. But at this moment I give normally most of the times 2500. Preparation takes always a little bit time. What's important is to flush the system. Yeah. We use the system of Volcano. So now we flush the system with the image on.
Dan zetten we op een half.
Here we go. Here comes the distal part of the stent. Kan nog wat groter. Can be post-dilated a little bit more.
Nu wel bij het knipje.
Zijn we voorbij. Now we're near the ostium. Here you see the other wire to the LED. Now we're on the left main. Here we are with the stent, and now here comes the guiding catheter, as you can see. Okay. Gaan we nog now we'll measure the access to the LED. This is the LED. The wire of the circ. Very nice big, good stent position. Now we're out of the stent, nearly out of the left main. And here the guiding catheter is. Okay. So the concept also is when we perform a PCI in the proximal part, when the distal part is very small, that you manage kind of flow-mediated vasodilation. And by that, a better perfusion in the distal part of the circ in this case. 14,
10, 14,
20,
20.
leeg.
Leeg.
Oké, nou klaar. Meer doen we niet. So now we did a 4-0, 20 towards the circumflex and partly in the left main with 20 atmosphere. Zullen we nog één opname zonder wires? So we will make one finishing. All right, klaar. One thing which is important when you remove the armplats from the left main is always turn a little bit, push it, turn it and pull it back. Okay, now we will retrieve the guiding. Laatste bloeddruk. So in conclusion, we performed a complex PCI of left main towards the circumflex with stentis Xposition S with an acceptable nice result, and additional stenting of the circumflex towards the MO branch with drug-eluting stent with also very nice result. Stentis Xposition is ideal stent for stenting when you have a mismatch of proximal branch to distal branch size, and as you can appreciate, the result is quite nice. Thank you for your attention.